I'm Dr. Karim Kurji, York Region's Medical Officer of Health. I'd like to remind you to visit our website, york.ca/COVID-19, particularly the dashboard, which gets refreshed at 5 p.m. every day. You will agree when you look at the graphs there that we seem to be getting control over the virus. We have a formidable army of 300 highly professional staff organized in multidisciplinary teams who are fighting this war against the virus. One of our smartest weapons happens to be contact tracing. When we identify a case, we interview them and we find out their closest contacts. And then we follow up on each and every close contact in order to ensure that they are self-isolating themselves. This way, what we do is we burn out the virus and keep the community safe. Last few days have seen an increase in the number of outbreaks in our long-term care institutions, retirement homes, and group homes. In addition to the normal stringent measures that are introduced in these situations, we have required the staff of group homes to also wear masks when they're delivering care at all times. This will not only protect our residents, but it will also protect our staff. This is a measure that goes over and beyond the measure that the ministry advises, because in our local circumstances, we feel that it is warranted. We have also ensured that all staff and residents, whether they are symptomatic or without symptoms, in these outbreak situations get tested. In addition to that, our infection control and prevention staff physically visit these outbreak situations, select ones, in order to provide additional observation, education, and support. Now, sadly, we still get individuals who are dying in the community and who haven't been tested for COVID-19. We find out after death that they had COVID-19. This shouldn't occur in our society. I would urge anyone with COVID-19-like symptoms, not just fever, cough, and shortness of breath, but also sore throats, headaches, myalgia, as well as diarrhea. Please seek out the assessment centers at the 3 hospitals, Southlake, Mackenzie Health, and Malcolm Stouffville Hospital. Get assessed and you shall be tested. Testing resources were scarce before, but are now being liberalized, and you're more likely to get tested now. This would enable us to reach out to your close contacts, but also it lets you know about your COVID-19 status. Unfortunately, some individuals with relatively mild conditions deteriorate rather rapidly, and some of them die. I would urge you to seek out medical assistance if your condition is deteriorating. Don't hesitate to call 911 if your condition deteriorates. Just let them know that you are COVID-19 positive. Finally, I'd like to remind you that we need to be vigilant. And so, please make sure that you wash your hands frequently. Don't touch your faces with unwashed hands. Make sure you keep your distance if you go out for short walks, and stay at home most of the time except for essential visits. We are seeing a recovery in patients. Almost 100 of our patients have recovered. And together, I know we can wrestle this virus down. So please take care, and thank you again.